Hi, I'm here with CEO of Iberia Medical Center. Could you please tell us a little bit about yourself?
Hi, I'm Dion Viator, CEO of Iberia Medical Center. I have been at Iberia Medical Center for about 8 years. Prior to that, I was originally from Ville Platte, my husband from New Iberia. We went to UL. We started our careers in New Orleans, and our goal in life has always been to make it back home. So spent about 7 years in New Orleans, spent 21 years in Baton Rouge, and then finally about 8 years ago had the opportunity to come back home to God's place here where people smile and they're friendly, and enjoying that.
And could you tell us a little bit about how you became CEO of the Iberia Medical Center?
Yes, so my degree is in accounting. Moved to New Orleans to work for a CPA firm, Ernst & Young. Worked there for 7 years, and quickly fell into working exclusively with healthcare clients. Loved the complexity of healthcare. I am definitely a lifetime learner. I think healthcare is so complex. As soon as you think you've figured out the funding and the reimbursement and all the different mechanisms, you've got more to learn. So then moved to Baton Rouge to be the CFO of a hospital system there until we had the opportunity to complete our journey back here. I started as Iberia Medical Center's CFO, and right before COVID, had the opportunity to move into the CEO position.
Yeah. You said that you started off as accountant, so would you say like the degree that you have doesn't really define what you're going to do the rest of your life?
Absolutely. I think there are so many things in life, or paths in life you can take. I think regardless of the degree, the CEO position, there are people that go and get masters of healthcare administration. There are people with clinical backgrounds, nurses or doctors. An accountant is actually an odd CEO position.
Yeah.
But I think if you have a passion for it, and you work harder than anybody else, then there is always an opportunity to achieve your goals.
Yeah. Could you open up to us about the responsibilities you have as CEO of a hospital?
The responsibilities as CEO, that's an interesting question because let me start with my responsibilities as they were as a chief financial officer. As a chief financial officer, I could come to work each day and I knew not only the reporting of the finances, but working with each department to understand their finances, to help them make better, to help with making sure that we had our supply expense and our labor cost in line, and then try to work with all of our payers to negotiate contracts with United and Blue Cross and all the others to make sure we're getting paid for the hard work we do. So I had a very structured day that I could predict, and it was all about making the hospital stronger financially.
Yeah.
When you move into a CEO role, it is much more of a relational role, your community responsibilities, working with the board a lot more directly, being in charge of being responsible for all of the operations of the hospital, every department of the hospital, and making sure that they have the resources and support that they need. And I also spend a lot of my time recruiting physicians to come work with us in the community. So it's a various activities each day.
And does your position, does it have any significance beyond just a career to you?
Absolutely. I think that's why I went into healthcare in general, because to me, healthcare is a mission. Unlike any other careers, when I was in public accounting, I took a stint and did some work in banking. I did some work in other different industries, and nothing touched me like being able to help hospitals get the resources they need to fairly pay nurses and buy the supplies to make an impact to the patients. And I think one of the things here, an added personal touch to that, is that this is our hometown. This is where we're from. and Iberia Medical Center is the only hospital in the entire parish. And so the responsibility to make sure that we have the care people need every day, but especially when you're here during a flood or a tornado and people can't move around on the roads or get any other place, we need to make sure we're here as a part and a partner to this community.
I know a couple years back, the hospital faced a little bit of damage, I believe, from a storm. Like, could you walk us through what you experienced during that time?
That was very difficult, different. We plan all the time for hurricanes. We've got plans that say 3 days out when it enters the Gulf, you do this, 2 days out, 1 day out. And so we have and we train a lot for hurricanes. This was a tornado. I never knew tornadoes went south of I-10 at all. And this was December 14th. And it was almost like the hospital had a target on its back with a direct hit. The things that was most unusual about that is that we had about 5 minutes to prepare, but our hurricane training really kicked in. Knowing what to do, the hurricane training, we had nobody was severely injured, even though our parking lot was destroyed, our building was destroyed. We had wonderful physicians and nurses in there. It was 11 o'clock in the afternoon, seeing patients, making sure everybody got down out of the building and over into the hospital where it was safe. And we've spent the last couple of years rebuilding. That's a first in my career to have an almost $10 million insurance claim and rebuild the building. So it is now 3 times stronger with its beautiful glass, and we've had some upgrades that we were able to do there. So at the end of the day, we can count our blessings. But it was unusual. It was unusual. People ask me the biggest difference between a hurricane and a tornado. And one, of course, is the timing, how quick it comes. But the second was with a tornado, the air is sucked out of the building. With a hurricane, the air comes into the building. And so with the hurricane, the air comes in and you're trying to brace the doors on. With the tornado, my hair went straight up, and it was almost like I was on my tippy toes running, because it just picks you up and moves you out to the building, which is an odd feeling.
So you were in the hospital when it happened.
I was in the hospital. If you've been in the hospital, I was right there by Miss Debbie in the reception of the hospital, on the front of the hospital. So it was an unusual day, and just one that I was just so proud of our staff, the way the patients were all brought to safety, the employees were brought to safety. I saw a lot of our workers in registration take all of the chairs out of the front lobby by the glass and bring it into, so we could have people sit and be comfortable. Our kitchen brought bottled water and gave hugs to people who were just scared. It really was community coming together.
Yeah, I want to say thank you for coming. It was wonderful to meet you.
Wonderful to meet you as well. Thank you for the invitation.
No problem.
I'll come back anytime.